The broadcast is now starting. All attendees are in listen-only mode.
Hello, welcome to the Theralaze webinar, Cold Laser Therapy Indications and Contraindications. My name is Dr. Rhonda Mostyn. I'm the Clinic Director at Theralaze, and I will be your host for this webinar. The topics we'll be discussing today include indications for cold laser therapy, contraindications, and cautions. This will be followed by live questions and answers. As Clinic Director at Theralaze, I field customer queries on a regular basis. Many of the questions are whether certain conditions can be treated. There are many documented, researched areas that show efficacy of laser treatment. However, there are also hundreds of conditions that have not been specifically researched. After reviewing the effects of and contraindications to treatment, you should be equipped to make your own clinical decisions about when it's appropriate to treat with cold laser. By the way, if you experience technical difficulties at any time, including audio problems, please call our office reception at 1-866-843-5273. Once again, 1-866-843-5273. We won't be checking the chat sidebar for comments during this webinar. Indications for cold laser treatment. We'll start off by reviewing some of the key generalized effects of cold laser therapy. The exact physiological processes involved are out of the scope of today's webinar, but I'll highlight the end results for you. Tissue repair, nerve regeneration, decreased inflammation, decreased pain, enhanced immunity, and vasodilation. Let's go through each of these one by one. Tissue repair includes repair of various tissues, including muscle, blood vessel walls, and bone. Nerve regeneration involves nerve cell or neuron proliferation and ultimately nerve axon growth. Decreased inflammation is predominantly due to activation of lymphatic vessels which pump interstitial fluids from injured areas back into the blood system. The anti-pain effects are likely a result of laser light causing changes in ion flow across the nerve cell membrane, altering the electrical potential across the cells. The enhanced immune response is due to stimulation of white blood cells, leukocytes, which are involved in defending the body against infective organisms and foreign substances. These include macrophages that destroy pathogens and cellular debris. They are drawn to inflamed areas and are particularly important in the body's defense against infection. Other white blood cells, including lymphocytes and monocytes, are also stimulated. A local and temporary increase in capillary blood flow is also a key effect of laser therapy. We'll now look closer at some of these effects. Tissue repair. So how does low-level laser therapy lead to tissue repair? Laser light stimulates ATP production in mitochondria, elevating overall cellular metabolism. This results in increased RNA and DNA synthesis, which promotes cell proliferation. So for example, laser light will stimulate the production of fibroblasts in a wounded or injured area. These fibroblasts will then produce tropocollagen, the precursor to collagen, and ultimately an increased production of collagen results. Collagen is the most common protein found in the body. It is essential for the repair of damaged tissue. Collagen is a substance that holds cells together, in particular the fibers of tendons, ligaments, and the fascia. Also, by increasing collagen production, less scar tissue is formed at the damaged site. Now, if laser light can stimulate collagen, many tissue types can be repaired. Here we're outlining the different tissue types associated with each collagen type. Stimulating collagen 1 will help repair bone and skin tissue. Collagen 2 will repair cartilage. Collagen 3 repairs reticular fibers, and collagen 4 will repair cell basement membranes underlying the epithelium and endothelium. Laser can stimulate the proliferation of all these tissue types and repair the affected tissue. Nerve repair. There are hundreds of positive randomized controlled trials on laser repair of nerve tissue, and also many theories of how this works. I've summarized here some of the key hypotheses and results from studies that investigate laser for nerve repair. The first few are related to growth and repair of axons, increased production of Schwann cells, increased rate of myelination of axons, and an increased number of axons. However, studies show that not only are nerves repaired, but the overall quality of the nerve fiber is improved, including less scar tissue formation around the nerves. Let's look closer at pain reduction. This diagram shows the flow of sodium and potassium ions across the channels in the nerve cell membrane. There are light acceptors called chromophores within cellular bilipid membranes, which, when activated by laser light, will cause an opening of pores in the membrane. These pores act as ion channels and ultimately affect the flow of sodium and potassium in and out of the cell. This is the key theory for how laser light can alter or slow down the propagation of electrical impulses along an axon and thereby remove pain signals. There are other ways in which cold laser can eliminate or reduce pain. For example, laser acupuncture stimulates the release of endorphins. Cold laser may also have a direct effect on the transmission of pain by unmyelinated C fibers that deliver dull, burning pain signals. Finally, low-level laser therapy reduces edema or swelling and thereby reduces the pain associated with large amounts of swelling. This diagram shows the body's lymphatic system. As I mentioned earlier, activation of the lymphatic system by low-level laser is the key factor in reducing swelling. Also, the temporary vasodilation helps to reduce inflammation by improving the flow of monocytes and macrophages and other inflammatory mediators to the area. This diagram shows the process of wound repair. This is an example of several effects of laser working together to heal an injured tissue. Fibroblast stimulation results in collagen for tissue repair. Epithelial cells proliferate to build walls of new capillaries and lymph vessels, and nerve cells regenerate to repair damaged peripheral nerves. Now that we've reviewed some of the key effects of low-level laser therapy, we can look at how these effects apply to musculoskeletal and non-musculoskeletal conditions. Musculoskeletal injuries are generally characterized by tissue damage, nerve excitability or damage, and inflammation. Most neuromusculoskeletal injuries, including chronic, acute, or autoimmune conditions, are excellent applications for laser. This chart highlights how different aspects of a neuromuscular skeletal injury are affected by cold lasers. For example, in carpal tunnel syndrome, nerve and tissue repair are important. As well, here we have our tissue repair, our nerve repair, but also the anti-inflammatory effects are important in carpal tunnel as well. In autoimmune conditions such as rheumatoid arthritis and ankylosing spondylitis, the anti-inflammatory and immune-enhancing effects of cold laser play a major role in injury healing. If the patient is free of contraindications, their musculoskeletal injury can almost always be treated with low-level laser therapy. For non-musculoskeletal conditions, the same principle applies. Treatment with cold laser is used to target the same key aspects: tissue and nerve repair, anti-inflammatory and immune-enhancing effects. This chart shows some of the conditions that are often treated with laser. For example, tissue repair is the key healing effect for ulcers, wounds, and hypertrophic or keloid scars and post-surgical sutures. Nerve and anti-pain effects are targeted in diabetic neuropathies, post-herpetic pain, and trigeminal neuralgia. Anti-inflammatory effects are paramount to treating asthma, hemorrhoids, chronic laryngitis, and prostatitis, which are all characterized by large amounts of inflammation. Inactivation of the immune system is critical in eradicating infections such as cold sores and plantar warts, or in modulating the immune response such as in Hashimoto's thyroiditis. Now let's review the contraindications to treatment. This is a comprehensive list of conditions or areas that should not be treated with laser. Let's review. Of course, we cannot treat close to the eye, as a laser can cause permanent eye damage. We recommend to stay away from an inch proximity to the eye, so never treat within 1 inch of the eye. Pregnancy. We recommend not to treat over the pregnant abdomen. Some practitioners choose not to treat pregnancy at all, but the true contraindication is treating over the pregnant abdomen. Infection. Some infections are actually indicated, such as fungal infections or viral infections, but bacterial infections are contraindicated, as we can stimulate growth of bacteria with a laser. Cancer. Cancer is something we get questions about all the time, and it is a contraindication whether it's benign or malignant cancer. We recommend waiting till the patient is 5 years cancer-free before we'll treat with laser, as we can stimulate the cancer cell growth rate. Lupus. We don't treat lupus patients because one of the characteristics of lupus is photosensitivity. They can be light sensitive, and treating with laser can aggravate the lupus condition. Scleroderma. I've listed scleroderma here, but truly any condition where there's hypertrophic tissue or a lot of tissue growth is something we might want to stay away from, as a laser can stimulate increased tissue growth. Some vascular disorders are contraindicated. Keep in mind that the laser causes a temporary transient vasodilation, but this can be risky if we're treating over an aortic aneurysm, a blood clot, or an internal hemorrhaging area. We don't want to stimulate any blood flow to these kinds of conditions. And finally, in patients with heart disease, treatment over the sympathetic ganglion, vagus nerve, or the heart area should be avoided. I get a lot of questions about cancer and risks of laser treatment in cancer patients, so I'll expand on this area a bit more. First, laser therapy cannot cause cancer, specifically at the power and wavelengths that Theralase uses, since it is non-ionizing radiation. Ionizing radiation is characterized by lower wavelengths and higher photon energy and can cause carcinogenic changes. However, we avoid treating patients with cancer, since in vitro studies have shown that laser therapy can cause existing cancer cells to grow. An interesting finding is that in vivo studies have shown very small tumors in rats to recede after low-level laser therapy, but had no effect on large tumors. The effect on small tumors is likely due to stimulation of the immune system, which in turn helps to reduce the smaller tumor. Here's a list of cautions, conditions for which low-level laser therapy may not be contraindicated, but the patient should be monitored for any reactions or the dosage may need to be reduced. So let's review this list. The first item on this list are tattoos. Tattoos can heat up due to the ink that's used for the tattoo if you put a high-density light like laser therapy over the tattoo. So avoid treating directly over the tattoo. Instead, treat around the area. If you must treat over the tattoo, for example, if that tattoo is directly over the injured area, you'll have to reduce your power settings, reduce your dose so that that tattoo does not heat up. Endocrine glands, such as the pancreas and thyroid. If you treat directly over these glands, you might stimulate them and cause them to produce an excess amount of hormone or whatever it is that they produce. So we try to stay away from treating over the pancreas or thyroid or any endocrine glands. Medications. There are some medications that we call photosensitive medications, and I'll be going over this in a little more detail in a moment. But these do include NSAIDs, corticosteroids, St. John's wort, or sulfa drugs. And if you treat these patients, there is a possibility that they will develop a rash or a sunburn. Immunosuppressants or immunostimulants. If a patient is on these medications, it may be a good idea not to treat them, as we do know that the laser can cause immunity changes. And finally, epilepsy. It is recommended not to treat someone who suffers from epilepsy, as flashing lights can cause or trigger seizures. Many practitioners and laser technicians are concerned about drug-induced photosensitivity, since it's common to have patients on multiple medications including NSAIDs, cortisone, or sulfa drugs. Photosensitivity is inflammation of the skin induced by the combination of light and certain medications. It may result in redness of the skin that at worst would appear like a sunburn, or it may be as subtle as a pinkish, flaky-looking patch. These symptoms would appear within 24 hours of the treatment. To avoid this reaction, you can reduce power settings to 50% and then gradually increase the power while monitoring any sensitivity. In practice, very few, if any, patients will react to the laser treatment, even if they are on light sensitizing medication. I have only seen 2 mild reactions which appeared as pinkish patches. In those cases, I reduce the laser settings for subsequent treatments. There are many questions that I'm frequently asked, so I'll address some of these on this slide. Can I treat over metal implants or shards of glass that are in the skin? This is not a problem, as cold lasers are non-heating devices. We will not cause any heating of metal screws, metal plates, or any problems with glass that has been imposed right into the skin. So this is not a contraindication. Now, you do have to keep in mind that these metal implants or rods or whatever it is are in the treatment area, so you may have to choose your treatment spots based on this. For example, if there's a metal implant in the ankle, keep in mind that the laser will not go through the metal implant, so you may have to choose some extra treatment locations to make sure you've had good coverage of the area. Can I treat over a pacemaker? Treatment over electrical devices is fine. This is not a problem. You can treat over a pacemaker. It won't heat up and it won't cause any disturbance in an electrical device. Is an open wound contraindicated? Actually, a wound is indicated. We treat wounds with laser. An open wound is indicated as long as there is no or little bacterial load. My patient has silver nitrate on his wound. Can I treat? We see a lot of patients with wounds that have silver nitrate applied to, it's kind of an antimicrobial technique, so they don't have any buildup of bacteria or foreign substances in the area. You can treat over this. The silver nitrate will not heat up. Is treatment over growth plates contraindicated? No, there is no effect on growth plate. In fact, the laser is safe to use with children as long as you're reducing your doses properly. How about treatment over the skull? Is this dangerous? This is not dangerous. In fact, very little light will even penetrate the cranial bones. Now that we've reviewed contraindications to cold laser treatment, I will try not to confuse you with this slide entitled, When Contraindications Are Indicated. We'll look at 2 examples of contraindicated conditions that in some circumstances are actually indications for treatment. The first example is bacterial infection. I stated earlier that low-level laser therapy can cause an increased bacterial load, so this should not be treated. However, light at certain wavelengths can actually reduce some types of bacterial infections. In this study, entitled Monitoring of Bactericidal Action of Laser by In Vivo Imaging of Bioluminescent E. coli in a Cutaneous Wound Infection, in this study, 810 nanometer light was used to treat E. coli infection in rat wounds. A bactericidal effect was shown. However, it was unclear if it was a direct effect on the bacteria or indirect by using the laser to dry out the wound, which would create a less favorable place for bacteria to grow. This second study investigated the effects of various wavelengths on 3 different bacteria species in vitro. 630 nanometer wavelength was found effective in diminishing these specific bacterial strains. A lot of research will be required to identify specific wavelengths that can target specific bacteria. With so many existing and new strains of bacteria, this is a difficult task. However, in some circumstances, laser may be indicated for bacterial reduction. This second example involves treatment over the thyroid gland. The reason we advise avoiding treatment over the gland is that studies have shown that the stimulating effects of laser may result in overproduction of thyroid hormones. But in the case of hypothyroidism, where thyroid levels are underproduced, could laser have a role? Here is a study in which the researchers investigated the treatment effects of laser in chronic autoimmune thyroiditis, a common cause of acquired hypothyroidism. Treatment was done with an 830 nanometer, 50 milliwatt continuous wave laser. 15 patients were treated twice a week for 10 treatments. The evaluation was done by ultrasound exam of the thyroid tissue, assessment of the patient's need for a synthetic thyroid hormone, and also their thyroid autoantibody levels. The results of this study showed that low-level laser therapy improved function of the thyroid, reducing the patient's need for synthetic hormones and reducing their levels of autoantibodies. In this controlled study, low-level laser therapy proved beneficial for hypothyroidism. There is much research still needed to determine the exact laser doses and wavelengths for this condition. Also, these patients would require close monitoring by medical doctors who can track their hormone levels and thyroid function. Still, this highlights another exciting area where cold laser may be indicated for treatment in future. Well, that concludes this Theralase webinar. I'll be taking your questions in a moment. I hope this information helps with your clinical decision making on when to treat with laser therapy, when caution is required, or when further investigation is warranted. Please feel free to start typing your questions into the question sidebar. While the questions are coming in, I'd just like to highlight some of our upcoming events. Our next webinar will be hosted by Jeff Elkin, chiropractic coding specialist, who will discuss billing for laser in the U.S. Also, we have 2 upcoming CE seminars, April 16th in San Francisco and May 14th in Levittown, New York. We often get requests for copies of our presentations. If you complete and return the feedback questionnaire that will be sent to you in the next couple days, we will automatically send you off a PDF copy of this webinar. I'll give you a couple moments to type in your questions, and I'll get to as many as I can in the next few minutes. Okay, so the first question is where can we go to find out more about different settings for the Theralase? Well, you can actually come directly to us. We offer full-time clinical support for Theralase customers, or if you're not a customer, we're happy to speak to you about this as well. And what you can do is go to our website, click on, our website is www.theralase.com. Click on Ask Our Expert. That's on most pages of our website. That'll go directly to actually my email, and I will either address the question or pass it on to the right person. Do skin reactions only occur at the site of laser application, or can they be more widespread? I have only seen them, and once again in very rare circumstances, at the site of the laser application. I've never seen them more widespread than that. And usually it's a very small area, and typically it would be just a little pink, dry, flaky area that might be irritated. At its worst, it would look like a sunburn. In my clinical experience, I've never seen anything looking as bad as a sunburn. When treating children, what would be a good starting point as far as power? This really depends on what you're treating, because treating a child's finger is going to be a different starting point than treating a child's hip. We give you a protocol sheet or summary sheet that outlines the best starting point for treatment for each area, whether it be a standard patient or a child, and I'm happy to get that out to you. How is prostatitis treatment with laser? Where is the laser aimed? This particular person has several patients with prostate issues. That's something I'd be happy to discuss with you if you want to click on Ask Our Expert. It is a fairly simple treatment, and typically the patient will more or less administer the treatment once you put the settings on. So this is actually an emerging area, and if it is within your scope of practice as a practitioner, please contact me and I'd be happy to discuss this. Should skin be prepared in any way before laser application? Does oil on the skin affect treatment? Oil on the skin does indeed affect treatment. That glistening or shiny area that would be produced by oil will reflect the light, so it's always important to clean off the skin first. We will clean the patient off and we'll also clean our probes off before treatment so that there's no debris or oil in the way. Have you ever had anyone say that it felt like the laser feels like it's burning or felt like a zap? The only way that it would ever feel like a burning is if you're over a very dark pigmented area, or for example a tattoo, basically a dark area that would absorb the heat. Then the patient of course will feel a burning and you have to quickly stop your treatment and reduce your settings. Other than that, I've never heard of or seen that situation. Well, that concludes this webinar. Thank you very much for attending, and we hope you have a great day. Thank you.